Namaste. I am Dr. P.K. Shantakumari, Chief Physician of Mada Ayurveda Eye Hospitals, Thiruvananthapuram. Today I am here to talk about something about an eye condition known as retinal tear. Retina is the most important structure of the eyeball that lies posteriorly inside the eyeball, and this is responsible for the very complex process of vision. Any defect in this structure will lead to some impairment or defect in the vision. And this a nerve starting from the brainstem, one among these 12 cranial nerves known as optic nerve, that starts from the brainstem directly without any branches in its pathway, comes to the eyeball and enters inside the eyeball from posteriorly. And when it enters the eyeball, it spreads into nerve endings. Actually, this is the main component, main structure of the retina. And when the light rays reflected from the external object and passing through the eyeball and refracted in such a way that it is getting converged on a particular point on this retina, and this convergence initiates a series of reactions, just like photochemical, then electrical, then electronical, and then nervous, and finally there is an outcome, that is formation of an impulse, nerve impulse. This impulse is carried through this optic nerve, same nerve, and it passes through these nerves and reaches up to the brain. There, the next step of processing is carried on, and the outcome is the actual sense of vision. So it is clear that if there is any defect in this retinal layer, it will lead to some visual impairments. And retinal tear is such a condition. Tear means any discontinuity in this retinal structure on its normal shape. That is known as tear. There are various reasons which may lead to retinal tears. An external trauma, that is very common, we can very well understand. If there is a very deep trauma or a very serious type of injuries like that, it will cause. I am not touching that portion. Now another thing is from inside the body or some pathologies developing in the retina. And we know the retina as such, according to Ayurvedic theory, is a structure having the dominance of Vata and Pitta. And this dominance and this normal function, for the normal functioning of the retina, this normal properties of Vata and Pitta is absolutely necessary. Among the various properties, this tractional, ushna properties of Pitta and Laghu, Chala or this Sushma properties of Vata are very important. These are to be kept intact. But if there is any change pathologically, it will lead to some changes in the retina and it will lead to further development of signs and symptoms. So when these properties of Vata, especially this Ruksha, Laghu, Chala, these are aggravated and this again vitiates the retina, then retinal tear will be an outcome. Some detachment inside the retinal cells, that is known as retinal tear. Then what happens? The normal function of the retina will not be possible. It will lead to some typical characteristic signs and symptoms. The main symptoms are this, such as blurring of vision general, and then there will be flashes of light seeing in the visual fields or floaters. These are very important. So this again will lead to further complications. Sometimes instead of this retinal tear, there will be development of small holes that also will affect the retinal function. The seriousness or the severity of the condition depends on the position or the area where this tear has happened or where this hole has happened. If it is near the macular area, that means on the near or inside and around the most sensitive part, macular area, then the symptoms will be very serious, vision will be seriously affected. And if it is only peripheral or away from the central area or away from the area where light rays are getting focused, then the symptoms will be comparatively less or not serious. So we have to consider all these things while considering the disease. And the tear, if it is very serious, then there is a chance of getting detached. Retinal detachment also may happen. That is not a simple thing. It will cause very serious visual problems. If the retinal detachment is total, there is a chance of possibility of total vision loss even. So coming to the treatment side, we have already seen that the aggravation of the properties of Vata is the basic reason for this detachment. So the aim of the treatment is to maintain Vata or to maintain the properties of Vata intact. For this, there are so many methods and medications, treatment procedures in Ayurveda. It should be in such a way that the Roksha, Laghu or the Chala properties should be subsided or reduced. For that, the main thing is medicated ghee, medicated oil, etc. And the medicated means that ingredients or the drugs are more important. The oil medicated with the Vata Shamana drugs or ghee medicated with the appropriate medicine to control the aggravation of Vata properties. And with these medicated ghee or oil, etc., there are different procedures to be conducted. Main among them are Shirodhara, then Shirovasti, Brahmanasya, etc. External to the eye. We can do all these procedures. And inside the eye also, we can do many procedures or many mode of applications are there to control this retinal tear. In other words, the aggravation of Vata on the retina. For that, we can use mainly the procedure of Tarpana, then comes Netra Dhara, then Ashodhana. That means filling the eye with the medicine and applying drops of medicine and the continuous flow, pouring of medicine, like that, it varies. But the main thing is the medicine selected for these things. And then we can control the aggravation of Vata. In short, we can say that if you are selecting the appropriate these drugs to medicate the oil or ghee or anything else, there are milk also can be used, other decoction also can be used. I am talking about some important things only. And if you are selecting the appropriate mode of application also and doing it in the correct time, correct clinical condition, then success is sure. Here we have to consider one more thing. When there is some other ocular conditions, often it is like that, something like other retinal degenerative conditions or age-related conditions like macular degeneration or glaucoma or some type of systemic condition, systemic conditions in the ophthalmos. It is glaucoma, cataract, like that. Then we have to be very careful about while handling this retinal tear. It should not worsen other condition, especially if the condition is cover dominant and the treatment is against these treatments of retinal tear. That happens most often commonly if it is not diagnosed correctly or the selection is not correct, then some side effects are possible or adverse effects also may develop. And the correct differential diagnosis and diagnosis of other conditions in the eye, also other systemic conditions like diabetes, hypertension, etc. also are to be considered, because these treatments and the procedure should not clash each other. So if you are considering all these things carefully, the treatment of retinal tear will be success. Thank you.